Good morning, Wolford Health Centre. How can I help?
It could kill you. Yeah. Or paralyse you. You're stuck in a bed at a young age. There's a viral bug that's causing a bit of sickness, a bit of vomiting.
But yesterday, someone told me if you're puking up, you could have stomach cancer.
I could hardly hear anything yesterday.
But you're not having difficulty hearing me?
No, no.
And if I lower my voice, you can still hear me?
So your legs have taken a fair battering, haven't they?
I can't wear a bikini anymore.
You need to bring your arms slowly forwards.
Oh, ow, that's you.
Good morning.
Good morning.
Hi, all right. Filled out all the forms and stuff.
We're all good to go. Hopefully you won't be sick, but welcome to the practice.
Thanks for your help. Cheers.
All right, thank you. Bye-bye. OK, hello, everybody. All right, you have a seat. How are you doing?
My chest is quite bad.
Right, OK.
I had a scan on Friday.
Yes.
And the baby's fine.
Yes. That's
No
good,
worries
isn't
at the
it?
moment, yeah.
Yeah. So how long's the chest been a problem for?
Over the weekend.
OK.
I don't know why. I don't know if it's changing weather or changing hormones. I don't know.
Yeah, and tell me a bit about it.
I'm just struggling to breathe.
OK, so sort of tight.
Yeah.
Yeah.
Can we come off of there, please?
And remind me, you're asthmatic, yeah?
Yeah.
And you take 2 different inhalers, yeah?
Yeah.
Have you haven't
Sorry.
had that many of them actually, have you?
No, I had spare ones at home, but
Yeah.
I haven't. I'm just on my last one.
Okay. What do you think's going on? Tommy, I'm going to give you something to do. All right. Can you do a drawing for me? Okay.
Sorry.
It's all right. So let's just see what your temperature's like. That's normal. Is the pen not very good? What you have to do is you have to hold the pen so it's like that, OK? Do you want one too? Yes? Okie dokie. You're good at drawing. OK, there you go. OK, so let's have a listen at the back first, just to breathe. Oh, that's fantastic. Oh, you've written your name. Wow. Can you do that again? You are quite wheezy, actually. Let's see what you get on this. $300. So that's a bit down.
Hopefully I can be fairly brief.
Oh, well.
In 2012, I came to the surgery
Yeah.
to talk about jock itch, because I was getting itchy.
Right.
So he gave me some Dactacort or
Yeah.
something. And it's never really gone away, 5 years later. And then, obviously, a lot of it's out of sight. And I took a photograph of my buttock about 3 days ago, and
Yeah.
I thought, well, actually, I need to try and do something about it. I presume that's all part of the same
Probably.
thing.
Yeah. Can I have a little look today? Is that
Yeah.
right? Do you want to go behind the curtain, or are you all right?
I'm not bothered.
And is it itchy?
You know, the general itchiness, you know, it comes and goes a bit.
Yeah.
There's up the crack there.
Yeah. Is there anything around the front?
Well, it's often a bit itchy underneath.
Yeah. There's not much to see at the front there.
But, it comes and goes, but it's never really gone away.
Sure. So it does look very fungal.
Yeah.
And the Dactacort cream has got some steroid in, which reduces the itch as well. So it's a really good starting point for what you've got. Now, if it's not working, then we can try a different antifungal medicine, and usually that will we'll find something that we can use that works.
Yeah.
And the other thing is to try a slightly stronger steroid just because the area is all a little bit inflamed.
Right.
And I think that will help settle down the itching side of it.
Yeah.
Sometimes you need to use a tablet of antifungal
Yeah.
to make sure that you're getting on top of it, because sometimes it's tricky to treat. And if it's been there for a long time and cream isn't making it better, then that may be the next stage.
Yep. OK, that sounds all right.
Nice to see you.
OK, thanks.
Great, I hope that works.
Yeah, I'll give it a try.
Bye-bye then.
Thank you.
That is a bit down, your oxygen, compared to what I'd expect it to be. Right, I think what we should do is treat this as an asthma attack. I think we should give you 3 things, yeah? I'm going to give you a spacer, you know, like one of those...
Tommy, get down, please, because you'll hurt yourself, good boy.
If I draw a picture, will you colour it in? What's that?
Dinosaur.
A dinosaur? I know I'm rubbish at art, but it's not that bad.
That's
it's
a cat.
OK, you colour it in with that biro, OK?
Tommy, that's a dinosaur.
Oh, that's brilliant. OK, so I'm going to give you a week of steroids, a week of antibiotics. It's OK with the pregnancy. Okay. In the meantime, you could also use a bit more of the blue inhaler at a time, which I'll give you. And unfortunately, in pregnancy, fantastic colouring in. Your asthma can get worse.
Yeah.
Thank you very much. Now, can you put the lid back on my pen? And are you going to give me your picture? Thank you. And we'll see you again if that doesn't sort it out.
OK, thank you so much.
That's all right. Bye, boys.
Thank you.
Bye now.
Oh, dear. You still got your cough?
Oh, it's terrible. They said below 6 weeks, so it's only 3.5 weeks so far. So.
Not that you're counting.
No.
Yes, what can I do for you?
My anxiety's through the roof at the moment. I cry for days. I can't go to the toilet, that's another thing. And when I do, it hurts.
Doing a poo or a wee?
And I keep getting pains under here and around my back. And you know me, I convince myself it's my heart. Oh, I know, I know. I can't help it. I hate being like this, I really do.
I know.
Sorry.
What are the big stresses you've got at the moment? Apart from your physical thing, what's going on?
Apart from Edward just leaving Bristol, nothing really.
And then her other door's leaving as well.
How far are they going? They're just going, one's going to London, one's gone to Dawlish. I don't know, I phoned 111 the other night and this guy chatted to me for like half an hour. He was absolutely fantastic. He managed to calm me down and the pains went. I know I'm probably a waste of time and space and energy, but I just feel... I just want to cry. I don't want to cry. But anxiety is something you can't help. I just can't switch it off and go, oh, it's nothing, and carry on. When I'm sat in a chair crying, I generally feel, you know, this is the end. If I can't get to the toilet, I push so hard that I do get pains under there and around there. So I know it probably is constipation as well. I just feel an idiot now. I'm sat here feeling stupid.
But you've got a problem. But I think your problem's anxiety, really, and fibromyalgia. When you say you're constipated, how many days has that been for?
I couldn't go yesterday. I couldn't go the day before.
Come over here and let me feel your tummy and just have a look at you.
I'm sorry.
OK, so lie yourself back. Do you ever pass any blood or anything?
No.
A little sore there. And over there?
Yeah, that's where I usually get my IBS pain.
OK.
If you find a heartbeat that's not mine, we're in trouble.
So what you've got is very exaggerated bowel sound, so it's going blah, 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 blah in there, you know, it's noisy.
Dr. Robert said when he diagnosed me with irritable bowel.
Is that what he said? Well, it's the same thing. So I think at the moment...
It's not irritable, it's downright nasty.
Yeah, nasty bowel, but it's not dangerous bowel, and I'm sure it's the same thing. And when you get stressed...
It plays up worse.
It plays up.
It's awful.
Do you remember over the years what treatments you've had for anxiety? Did you have cognitive behavioural therapy?
I did. I think that was left once.
If you ever want to try CBT again, we can get you sent back, because in the long run, that's probably going to be the most effective. Go home and just think about this being anxiety and relax. And your children haven't left the planet. They're just doing well and gone
You've got
to
your
London.
grandchildren.
Yeah. Well, you will get used to it. It just takes a while.
Thank
Okay.
you.
All right, okay, bye.
Thank you. Bye-bye. Ronald Trump. So you haven't been up to much in America recently, have you?
I phoned the 111 people and they scared the hell out of me by saying, you've got an hour to get to hospital. I was like,
I think by that what they probably meant was your appointment's in an hour, so you've got an hour to get.
And it looks a little bit snotty.
Say, no, I don't.
I have a migraine.
Migraine. I don't know what you call them.
I don't even know how it's spelled, so I'll just leave it there.
Did you see any boats on the canal?
On the canal?
Yeah.
What
canal?
canal? Oh,
Hi, what are we talking about?
Right. Basically, what it is, I'm finding my ankles in particular really difficult to deal with, especially my right leg. I don't know what this stuff is on my skin, but it seems to be pain, swelling.
How long's it been swollen like that for, then?
The last few months.
Is it in the ankle or is it in the leg?
It's right in the ankle.
Yeah, let's have a look at the other one.
Now, the other one is...
So what happened to this leg, then?
Oh, this... Oh, God. I had polio when I was a baby. I was one of the last ones to actually get it and caused paralysis from my knee downwards into my foot. And this is necrotizing fasciitis. Started off with a stinging in my knee.
Yeah.
Then after about 10 minutes, I started shaking and perspiring.
Yeah.
I read up on it, and there's a certain type of house spider which carries a bug.
So it's left you incredibly disfigured, hasn't it? With all that infection, and then presumably they did an operation on it?
Yeah, they had to take...
you were lucky not to lose the leg?
Yeah, layer of skin from my bum.
Yeah.
It's such a nice bum before as well. But
it's this one that's the problem today?
My foot won't be very clean because...
That's all right, don't worry.
I can't get down.
That's all right, don't worry. This brown skin is called varicose eczema. And that's because of the varicose veins, the fluid leaks out, and that brings with it some iron. So some of the veins then leak, and the iron gets deposited in the skin, and it can cause usually itching and brown staining, but it doesn't usually cause a lot of pain. Can you make the ankle go round at all?
I've got no movement on my toes whatsoever.
OK. So your legs have taken a fair battering, haven't they?
I can't wear a bikini anymore. It's stupid. It just get laughed at.
And you've had the heart done as well, haven't you? And I guess I'm just wanting to listen into that and listening to check your chest as well.
The brain's all right, by the way.
Good.
So far, anyway.
So I think that there are lots of things that are going on here.
Yeah.
One of them is that I think you've got this varicose eczema, and I can give you some steroid cream that will help in case any of this is linked to that rash that you've got.
Yeah.
It wouldn't particularly explain the leg swelling.
No.
And it's also that there may be some arthritis or some damage in the ankle on that side as well. So I'm going to get an X-ray of the ankle and just see what that's doing.
Right, OK.
In terms of the heart, that could be linked as well, because you've had the valve replaced. Sometimes if the heart isn't pumping very well, that might make some fluid collect in the ankles as well. So I'm going to get a blood test to check the heart and the kidneys and the liver, and I'm also going to do a chest X-ray to make sure there's no fluid collecting there. Now, when I listen, there isn't, so that's good news.
That's brilliant, OK.
How's that for a plan?
Yeah, that's fine. I've given up the cartwheeling, which is just ridiculous, you know. Anyway.
Listen, well, I'm glad that you're keeping in good spirits.
You've got to have a sense of humour, otherwise you just go absolutely...
Well, I think that's definitely true. That's definitely true.
OK, thank you very much. By the way, what's brown that runs around the garden? A fence. All right, see you later. Bye-bye.
I'm Dr. Graham. So how can I help today?
I have had a sore throat since Wednesday, and as of yesterday and today, it is raging.
And have you noticed anything else, like a temperature?
Today I probably feel like I've got a bit of a headache and a little bit hot, but then I've had a boozy weekend, so I don't know if it is that.
OK.
So I can't really differentiate between the two at this minute.
And you coughing? Much?
Not coughing much, no. But if I have had the odd cough, then it really hurts sort of right in there. I can
bring anything up when you cough?
No, I'm not bringing anything up.
OK. And you remind me, do you smoke?
No.
OK. So let's check you over. Take your temperature first. Open up wide. Put your tongue back in, actually. I'm going to put it down a bit just to look at the throat. OK, that all looks fine. You actually don't have any tonsils to see, which is normal for your age.
Right.
OK, so they disappear as you get older because you don't really need them. Just relax your chin down. And it doesn't look too red, and you've definitely not got any pus or anything. Does that feel sore under here?
Sore there,
yeah. OK, so that is sore there, but no glands that I can feel. But that is where your glands are, and they probably are sore there because that's... Do you know what your glands are for?
No, I haven't really thought about it, to be fair. But...
so they're where you make white cells. So when you've got a sore throat or any infection, you make more white cells, and that makes the gland get bigger. And often it actually hurts quite a lot, in some ways more than the problem that it's trying to fight. So I think that's the main problem. So I think the most likely thing is that this is a viral sore throat, OK? And that unfortunately it will last probably another at least few more days, maybe even another week.
Right.
You've had it since Wednesday, so it's about day 5 now. And they say that it takes sort of 7 to 14 to clear. And at the moment, I think that you will, you're normally quite well and you will probably clear this yourself. It's a kind of annoying problem where, if I get it, it's not much more I can do apart from take painkillers and wait for it to go.
Okay.
And at the moment, there's no evidence that you've got the kind of infection that will get better quicker with antibiotics.
Right, OK.
Does that make sense?
Yeah, no, that's fine. I just wanted to make sure that there wasn't anything because it's just been getting worse, so that's fine.
And was there anything else today?
No, that was it. So just plenty of fluids.
Yes.
Right.
Painkillers? Have you tried some painkillers?
I haven't, no, because I just find that sort of stuff doesn't really touch the sides, if I'm honest.
Yeah.
So.
I mean, it's entirely up to you, but lots of other people would take paracetamol or ibuprofen or even gargling with aspirin. Some people find helpful.
Yeah.
Because it's sort of anti-inflammatory on the actual throat problem.
OK.
But you don't have to take anything.
Yeah. OK. All right, no, that's fine.
Great.
Lovely, thank you.
Is it raining still?
It stopped. Stay that way.
All right then.
Thanks.
Bye now.
Bye.
Where are we to?
I'm not allowed to wave?
No.
Is it against the practice, the surgery rules? Yeah, OK. I'll remember that for next time. No waving, no smiling, no laughing.
Absolutely, yes.
And only compliment the reception staff.
Absolutely.
How you doing anyway?
Oh, just take it easy.
Right, so I'm Dr. McLaren. Nice to meet you.
Yeah, I've managed to slip in the bath, which aggravated my shoulder. And then I was looking out the window and it cracked. And I couldn't move. I was in so much pain. And today it just feels unbelievably tender.
Did you land on your shoulder? Did you land on your hand?
I kind of landed there.
OK.
But it wasn't too painful.
And then subsequently, this pain just started abruptly when you were doing nothing, and since then it's been really painful. Have you tried any painkillers? Or...
I did yesterday, aspirin and codeine, but I can't really take codeine at work.
What is work for you?
I'm an apprentice plumber.
OK.
So I need my marbles around me.
OK. Is there anything that you were worried you might have done or...
I'm paranoid it's a rotator cuff because it will take ages to heal. Hopefully you're going to tell me that it's something lovely.
OK, like...
Something that will heal in a couple of weeks.
OK. Well, let's take a look at it to start with.
Yep.
Easier for me with you stood up.
Stood up.
Now turn and face me. OK. I want you to bring your arms slowly up. Touch at the top.
I don't want to.
You stop as soon as it's uncomfortable. So at what stage did that become uncomfortable?
Well, I grunted.
So...
Can I put them down?
Put them down. If you were to do the same forwards...
That's fine.
That's easy. And right the way to the top?
Yeah.
Easy.
Oh, ow, that's
right
new.
At the top.
Yeah.
If you go across there, that looks like it's quite uncomfortable.
It's not nice, but it doesn't hurt anywhere near as much as when my hand was up.
OK, that's it. So you mentioned rotator cuff. It's not entirely typical of that. but I'm not going to be able to say with complete certainty that that's not what it is. This is your shoulder. Your rotator cuff is muscles which support the shoulder, which go over the top of the ball of your shoulder, around the front, around the back. The other thing that you have is ligaments and tendons holding the other structures together. You're quite tender around where your shoulder blade joins your clavicle.
Yep.
And really quite tender when you had to do that movement forwards, which is putting stress around this area, which makes me think it's probably a soft tissue injury to this area rather than your rotator cuff.
That's cool.
I think either way, I would expect with avoiding heavy lifting.
Like lifting radiators and...
Yeah, exactly.
OK.
Taking ibuprofen regularly. Things should start to improve, certainly over the next couple of weeks. And if you're not making any progress, come back in and see us. OK?
Right. Thank you very much.
Hi, can I help?
I want to make an appointment for Dr. Edge next.
Just the next possible appointment.
Yeah. Is your mum a doctor?
Yeah.
You look so like that.
I know, I hear that a lot.
Lovely.
Hello.
Hiya. I did bring my mum down before to have a little test for dementia, and she passed. She's a bit forgetful. Like, things will come out not quite in a proper sentence, like words would be the wrong way round them.
Yeah.
She can get quite argumentative as well, which I know is another sign. If it is the early stages of dementia, I would like to know if she can possibly start taking the tablet that prevents it from coming.
OK. We're quite a long way off that, OK? We'd have to make a diagnosis first, and there's certain things that we'd have to do, but we certainly talk about it.
Yeah.
We'll talk about that now. Is that all right? How long ago was it that you brought her down and she had the test for which she passed?
About a year,
About a year. OK. Do you think that you've got worse since then?
No, not really.
Do you?
Yeah, but not really bad.
You're living on your own? OK. To get a diagnosis of dementia, we ask lots of questions, but lots of us get a little bit forgetful.
Yeah.
But are you functioning OK? For example, are you managing your own money and your
Everything.
shopping and all that kind of thing?
Yeah.
Functioning fine?
Yeah.
So the geriatricians, the elderly experts, would actually say that you need to have both the sort of forgetfulness and all that sort of thing and what we call a functional problems.
Right, OK.
Like not being able to do stuff. OK?
Yeah.
But let me just find the previous...
But he was adamant I was all right. Wasn't he?
Yeah. Yeah, which is good. You think I'm coming down and I want you to have dementia? I don't. I want it to be stopped if you have got it coming.
Our centre can help you. Oh, sorry, my lovely. Yeah, it's just really busy, I'm afraid.
I was sitting in there and I've seen it so packed.
Are you running really late? Yeah, I am, sorry. You can come to the duty doctor surgery at 11:30. I'm sorry.
It's 6 weeks on it.
Yeah.
I'll be back in 2 minutes.
What a day it's been. Have you been busy?
Oh, yeah, manic.
Thank you for waiting. I've had a few urgent things going on.
Yeah, you can't be dealt with. God, it's only 5:10. I feel like it should be 6:10.
Thank you for waiting.
It's all right. It's busy.
It's always busy. All right, let's do that same questionnaire again. OK, first thing I'm going to do is I'm going to give you an address. I want you to say it back to me, and then I want you to try and remember it, and I'm going to ask you again in a bit.
To confuse me.
The name and address I'm going to give you is John Brown, 42 West Street, Kensington. Could you repeat that?
John Brown, 42 West Street, Kensington.
OK. Can you tell me the date today?
7th, I believe.
The year?
70.
Excellent. Can you tell me something that's going on in the news at the moment?
Oh, the fighting, the shooting and that, you mean?
What do you mean exactly?
Well...
Who's doing it, Mum?
Oh, sorry, ISIS.
OK. All right, that's fine. Can you remember that name and address for me now?
John Brown, West Street, Kensington.
What number?
Oh, I didn't hear a number. Did you give one? I'm sorry. I didn't hear the number.
I didn't hear the number. OK, you clearly remembered it. That's fine. All right. She's not going to fail this. OK, now I'm going to ask you a couple of things, all right?
Yeah.
Compare now to a few years ago. Is she having more trouble remembering stuff that happened recently? Like the news and stuff?
No, not the news per se, but she might put her glasses down and she can't find them.
Find them, all right. Does she forget what you've said to her?
Sometimes, yeah.
OK. Trouble with financial
No.
pain? No, OK. Manages her medicines?
Yeah.
I don't think there's any sign here.
That's fantastic.
OK?
Yeah, that's
All
brilliant.
right.
Yeah.
So now I can cuss her, can't I?
Yeah, you can tell her.
Keep telling me off now, yeah. No, but it's only because I work with people with dementia. To me, it's like I see little things.
OK, well, let's keep an
going on.
eye and you can ask me. But, I mean, so many people get that thing about putting the glasses, you know, I mean...
Easy done, isn't it?
Yeah,
done.
no, yeah,
I'm
but she
not
wasn't
that-
like that before, do you know what I
Yeah.
mean? It might just be old age.
It's just age.
Yeah.
Yeah, I'm 78
I would rather my mum, you know, got old gracefully than rather than ending up...
OK. I'm not going to say anything about that.
Nice to see you after so long, though.
Nice to see you, yes.
Yeah.
All right. OK.
Thank you.
All right,
Bye-bye.
OK. All right,
Bye-bye.
then. OK. Yeah.
Sorry, my key's on the floor.
Oh, that's no good. No, I won't be testing you for your forgetfulness. All right, OK, bye-bye.
How can I help?
My son is here. I can't find him.
What's his date of birth?
Oh, now you're asking. 17 of the 3rd. 02, I think it is. No, it's 23rd, isn't it?
23rd of March.
His sister's 17th.
Okay.
Right, what can I do for you?
Well, I came Friday.
Right.
Because I've been got a blob in my eye.
Yeah.
And I went to the eye hospital and he's told me that I've had a stroke.
Right.
My eye aches and my head aches all
Right.
the time. And I think it's affected my hearing as well because I hardly hear anything.
Oh dear. So how do you feel about what they said?
Well, I was a little bit shocked.
Yeah.
But he said they're referring me to the stroke clinic.
Right, OK. Have you heard from them yet?
Nothing, no.
No. I'll try and chase that up. We'll have a little look at you and then I'll see if I can get through to the stroke clinic now. Because you need some blood tests and a full assessment. How long did the problem with the eye last for?
I've still got it.
You've still got it, yeah. OK. Your blood pressure's good, so that's good. Can I just have a little listen to your heart? OK, sometimes it can be an irregular pulse that can cause a clot to travel around and cause the stroke, but at the moment it's nice and regular. Deep breath and out and hold it there. That's fine, OK. Right, so they'll arrange a CT scan in the stroke clinic, OK, to assess your head. What we want to do is reduce your risk of having this again, OK, and try and work out why you had it this time. Do you smoke at all?
Yeah, but I've cut down since.
OK, how much do you normally smoke?
Well, about 10 or 12.
OK, you need to stop.
Yeah.
Yeah? This is a warning.
Yeah.
And luckily, you're good. Yeah? But it could kill you. Yeah. Or paralyse you, stuck in a bed at a young age.
OK, what can I do for you?
So, just today, I've had this rash kind of appear. It's quite bumpy.
So, any of these tattoos new?
No,
'Cause
these are
sometimes
all...
you get
these
reactions
are all, like,
to tattoos,
kind
so...
of 10 years old.
I agree. It is a little bit lumpy skin, isn't it?
And it's just been quite...
But it's interesting because you're lumpy in the area of the blue. Actually, let's just look under, getting under some magnification. So, this, I mean, it looks very much like this is some of an allergic response to the ink in the skin, and we do see this from time to time. And usually, it's when somebody's had, you know, a new tattoo or something that's caused it to flare up. But that's not the case with you.
No.
In terms of what we do with this, if it's really troubling you, a mild steroid cream will probably settle it down.
That's good. It just puts my mind at rest. And
So you used to work in one of the churches, is that right?
No, I work in Southmead at the Southmead Development Trust, which is a charity.
Going well?
Yeah, very well. I mean, we're trying.
And last time you came here, you did talk to Dr. Wardock about a vasectomy, did you?
Yes. I think we're ready to take that to the next step.
You are ready? Or
Yeah,
you're
we
not
are ready. Having talked about it. So
OK.
I need to. What is the next step for that?
Well, the next step is one of us
Book an appointment.
needs to write a letter, actually,
Okay.
basically, and get you seen. You've got 2 kids? Both in good health?
We've got 2, yeah.
Both in good health?
Oh, yeah, absolutely fine, yeah.
Your wife wants to go ahead with this?
Very lively. Yeah, she does. You know, part of the reason is that she's... We've tried pretty much all the other kind of long-term contraception things, and they've all just been... had side effects and just been a bit unpleasant, so...
Richard gave you a leaflet with all the...
He did, yeah, I read that, looked for all that. Yeah, that was
so it's your call. I mean, we don't need to deal with it today, but if you
if we can write the letter...
I can write a letter and get you in the system.
That'd be great.
Fine.
Excellent.
OK, and then the next thing you know is that you'll get a letter with an appointment to
OK.
go
That'd be fantastic.
to have it done.
Yeah.
Take it from there.
Yeah,
OK.
that'd be fantastic.
Looks like Richard's giving you the chat ready.
He has, yeah.
OK, I'll get that done.
Thank you very
much. You sure I'm not pushing you into...
No, absolutely. No, honestly.
I saw that was the last thing. It looked like you'd been left hanging.
No, we talked about it. We thought about it for quite a long time, and then kind of just... I think it might have even been before Christmas.
I'll give you a 2-day cooling off period, OK? I'll write a letter next week if I haven't heard back.
That'd be fantastic.
All right?
OK, great.
OK,
Thank you very much.
Bye.
You all right? Your pain in your head?
Yeah, it's all there.
OK.
In the backs of my eyes.
I'll see if I can get through to the stroke clinic now. Oh, hi, I wonder if you could help me. I've got a patient with me who presented to us on Friday with eye symptoms, loss of central vision, and she was referred to the eye hospital. I mean, she needs to be seen today, really, doesn't she, if she's got ongoing symptoms? So shall I wait to do anything until you ring me back? Right, she's just going to check with the consultant.
I got a pain in this eye, and I'm worried to death I'm going to get another blob.
What's the one thing you can do?
Stop smoking.
Yeah. From now?
Yeah.
Yeah. Because that's the biggest risk.
Yeah. What causes blood clots, Sam?
So, as I said, one of the commonest ones are an irregular pulse. Another one is narrowing of arteries in the neck. That can throw off a little clot, and that can go to the brain as well. So what they'll probably do at some point is arrange a monitor to monitor your pulse over a week or so to check to see if that happens. Yeah. And also they'll probably scan your neck to check there's no sign of any blockage there as well. OK. And they'll probably arrange a CT scan or an MRI of your head as well.
Yeah.
OK. A stroke is potentially life-threatening, so it's very important to act quickly if anybody's got the symptoms of a stroke. A way of identifying that is by using the word fast. So the F is for the face, if there's any facial drooping. A is for the arms. Can people raise the arms above the head? S is for slurred speech. And T is for time, acting quickly by calling 999. Hello, Amanda Ramshaw. But as she's got ongoing symptoms, I'm concerned, to be honest. Just thought the guidelines say that we need to send people in. But yeah, so the options are we either send you to the emergency department today, or we can arrange for it to be seen in clinic tomorrow by the stroke consultant.
Yeah, I'll go tomorrow.
You'll go tomorrow, is it? OK, all right. Yep, she says she'd rather do that tomorrow. OK, bye-bye. Right, OK. So I'll send this off now. It says all patients should have 300 milligrams of aspirin, OK?
Right.
And you mustn't drive.
Right, OK.
If you don't hear anything by lunchtime tomorrow, let us know.
OK.
All right.
Yeah, thank you very much.
If you want to make an appointment for the smoking clinic, please do.
OK.
All right. OK, good luck.
Thank you.
Bye-bye.
Bye.
Oh, my love, take care. Bye.
Come on through. Hello.
Hiya.
Come on in, come and take a seat. I'm Dr. Ahmed. So, Murath, you had a accident. You were knocked off your bike. Did you go to A&E when that happened?
I went to A&E, and after A&E, we came here.
Yes, you saw Dr. Pelly. You had cocodamol and naproxen given because you've got a dislocated little finger.
This is not the problem why you were down there.
OK, that's all right. I just want to get the background
Yeah.
first as well. And what's happening now with the finger or with the plastics team?
Finger is same. I got pain on my shoulder, really pain. And since Sunday, I haven't been eating. So I
Okay.
haven't been eating nothing. That's
You haven't
4
kept
days.
nothing down since Monday?
Yeah, then when I go to toilet, it's just water comes out.
OK.
And I have really bad pain in my spine in here.
In your lower back?
Since the accident happened, my body changed. I don't know what happened.
How did you come off your bike?
The 26-ton of truck hit me off my bike. I nearly died. I nearly went underneath. And
But you didn't hit your stomach
his
or
stomach was
anything
fine.
like
No,
that?
it's- Last when I
So it was a
turned
close
yesterday,
thing.
But someone said I might lose my belly button because I was so frightened. Belly button moved.
You listen to too many stories.
OK.
I talked to my mum
All
back home in Turkey. That's what she said. But yesterday, someone told me if you're puking up, you could have stomach cancer. That makes me more.
Bless you.
No, don't. It's an allergic thing.
Oh, right. He's got a small allergy to dust mites, so that does make his breathing bad sometimes.
I'm allergic to penicillin.
Won't give you that.
Plasters, wool. I'm allergic to a lot of...
Wool?
Yeah. What? I don't know, I've got really sensitive skin, so wool makes me come up in a rash. Some shampoos make me...
It's the ginger gene.
It is.
I'm a closet ginger as well.
Can you be allergic to tea?
I wouldn't have thought that would be a reason.
How are things going with your breathing then? How are you
At the moment, things are good.
Yeah. Did you do the primary rehab then in March, it says here?
I went along to the actual appointment. My blood pressure was so high. I mean, I did warn them that I'd been
Yeah.
kicked out of gyms before because of my blood pressure being so high. And it's
Right.
not that. I had a reaction to the sulfites. I mean, sulfites are the worst to give me.
Right.
And I don't care what anyone says, I am allergic to them. I mean, the alcohol, it's the sodium methoxysulfite in it, which is a
Right.
confirmed allergy
Yeah.
with me. They sterilise the equipment.
Yeah.
And that is what I'm reacting to
to.
in the alcohol. And they put it in eye drops, ear drops. I mean, it's like I have no access to any pain relief because if I'm in pain, they tell me to take paracetamol, which contains sodium methoxysulfite sulfite. So I have no pain relief, which is why I kick off so much.
So you're only taking the one inhaler then?
Yeah.
Yeah, so you're
I can't
taking
tolerate the lactose if you have any more than that.
Okay.
Because I'm lactose intolerant.
Yeah, saw that one. But you haven't had to have any oral steroids in the last year?
Well, the last time they gave me steroids, they nearly shut my lungs down. And that's the maize starch in it.
Yeah.
And with the maize starch, when the manufacturers manufacture it, they put sulfite in it.
Right, let's do your blood pressure. (146/82).
Good, it's back down again.
So, I'll get this ready. And you remember how to use this? Blow, but then you keep... Right, when you're ready, a nice big breath. Well done, take a seat with it. Let me write it all down. Let's have a look. Yeah, so we don't need to change anything. Right, but I will refer you to the primary rehab. So that's our plan. Is that all right?
Yep, that's fine. That's fine by me.
Lovely. And I'll see you hopefully in a year's time.
OK, I'll see you in a year's time. Bye.
Bye.
Someone told me if you're puking up, you could have stomach cancer.
That's made you very worried about it. OK. So let's check you over. OK. And do you feel sick in between these
Yeah, I do.
vomiting episodes?
Yeah,
as
I
if
feel sick.
I know he's quite poorly because he can't even smoke a whole cigarette.
there's always some good thing out of a bad thing. Are you able to just lie down on the couch?
Yeah.
OK.
There.
There's generally a bit all over, isn't it? Yeah. OK, come and take a seat. So look, I'm sorry that you had this accident from your bike, but
I think it's
it could have
separate,
been
though.
it could have been a lot worse.
Yeah.
This is a separate issue. You're right. I mean, I think you've got a bit of... there's a lot of it going round, actually, this week. There's a viral gastroenteritis or a bug that's causing a bit of sickness, a bit of vomiting, a bit of loose poos. So we can give some tablets to help with the gripey pains and just drink fluids, but I would stop the naproxen. It probably aggravates...
I don't have cancer or nothing.
No. There's no symptoms of any cancer.
Okay.
OK. If anything gets worse, you know where we are, or changes, but this should settle things.
Well,
I'll keep you there. All right?
Thank you very much.
That's all right. Take care for now.
Thank you.
Right, how can I help you?
Can I have some batteries?
Oh, that what you wanted? I could do that. Easy. 1 or 2 hearing aids, Mr. Dunn?
3.
3. And 1 in the middle.
What can we do for you today?
Well, it's my ears, doctor. For some months now, I've been getting like a buzzing. And a couple of weeks ago, I went all strange. I nearly passed out and I was sick. And then yesterday, the buzzing in my ear was so horrendous, it was awful. It was like it was full up with something, you know, sort of like blocked.
Have you noticed any difficulty in hearing?
I did yesterday. I could hardly hear anything yesterday.
But you're not having difficulty hearing me?
No, no.
And if I lower my voice, you can still hear me? When people get buzzing in the ear, it drives them mad.
Last night it did.
Kept you awake?
Did last night. I went to bed. I find that I've got noise going on in the house all day because then that takes it away. I've got the telly
that's
going.
Very interesting. You've hit on the solution, almost.
Oh, right.
Have you ever been exposed to loud noise? Never worked in a very noisy environment?
Dry cleaners is about as
No.
noisy as it gets.
You're not addicted to going to awful loud concerts?
No, nothing like that.
All right.
No. A bit old for that now.
Tell me if I hurt you. Well, your ears are as clean as a whistle, I tell you, you don't need them syringing. That isn't the problem, whatever the problem is. Same with that one. Very good. Tuning fork. Can you hear that? If I put it there, can you hear it?
Yeah.
Good. Same thing. You hear that?
Yeah.
Bit louder there or there?
There.
Good. That's how it should be. What I'm going to do is call out some numbers to you. Just call them back.
Okay.
So if you put a finger in one ear, all right? 62.
62.
32.
32.
Thank you. Other ear. 78.
78.
14.
14.
That's fine. I can't find anything wrong with your ears. But, you know, you don't get the buzzing for no reason whatsoever.
No.
If things change, then we should see you again and do something about it.
You've disappointed my children now, you know that, don't you?
Because?
They think I'm all gone deaf.
How do they know? How do they know? We've proved you're not going deaf.
Oh, Mum's going deaf. They
don't want you to... Well, they don't want to get you to age before your time, all right?
Right. Oh. Thank you very much, Doctor.
Good.
Nice
Bye-bye.
to meet you. Bye.
Nice to see you. You gonna give me a wave? See you later. Goodbye.
All right,
Cheers
thank
then.
you.
Bye.
Right, that's lovely.
Very good.
Thank
nice
you.
to see you, Tracy.
Okay.
See you in 2 years.
Yeah,
Or
probably.
sooner.
Yeah. Bye-bye.
Take care for now.
Thank you very much.
That's all right.
Have a nice evening.
Thanks. Bye-bye.
Bye-bye.